And now the news. Persons accessing health services from Peebles Hospital will now confront a huge hike in fees under the recently introduced Hospital Regulations 2014. But Chairman of the British Virgin Islands Health Services Authority Board, John Klein, says it is not sustainable for government to continue subsidizing healthcare costs in the BVI to keep prices low. He showed where, despite the increased fees, hospitals in neighboring countries such as St. Thomas USVI and Anguilla are still charging higher fees than the BVI.
For more than 40 years, medical services in the territory have remained the same, while the cost for providing those services has significantly increased. For example, while inpatient room cost per day remained at $25, the average cost per day for government hospitals in the region is around $1,100. In our neighboring St. Thomas Island, cost for a semi-private room is about $1,175, and in Anguilla, it is quoted at $375. Our rate is still cheaper, and it comes in at only $225. Many government administrations in the BVI have left the cost of health care low, and they have done that by subsidizing it very heavily. However, this is unsustainable, and really, if we are honest with ourselves, it is a threat to our national economic security. Therefore, in order to sustain the healthcare needs and provide the services necessary, this administration have developed and implemented the National Health Insurance System, which we hope will be implemented very soon, because it is one of the ways we hope as an organization to survive.
Minister for Health and Social Development Ronnie Skelton says in order to minimize any economic burden resulting from the implementation of the new fees, the BVI Health Services Authority will continue to create affordable payment plans for uninsured persons. He also said the Ministry of Health and Social Development will continue to subsidize the wards of the state, the uninsured without income, and the indigent until the implementation of the National Health Insurance System. Meanwhile, in response to concerns expressed by members of the public, Chairman Klein says no one seeking health care will be turned away from Peebles Hospital.
Now, while that has been done, we understand that the public has some concerns about the increased fees, but we want to assure the public that no one seeking health care at Peebles Hospital will be turned away because of their inability to pay. However, it is important that those persons who have health insurance that pay for health care services, primarily they use it for paying for health care services overseas, that when they come into our facility, that they present their health insurance cards. These insurance providers, I think, are very happy to pay our fees versus the fees that they have to pay overseas, because the overseas fees are much higher. So we are confident that the health insurance providers will have no problem paying our fees. So it is our position that not only are the fees justified, but the fees are very, very necessary. If we are going to help this territory succeed in providing the best health care possible and to prevent our people from traveling to our neighboring islands and the United States to find health care, these fees are of a necessity. It's not because we want to make a great profit. It will not help us to do that.
The hospital regulations of 2014 have been in the pipeline for over 5 years. The new regulations repeal the hospital regulations which were first enacted in 1927. And before 2014, the last amendment to the hospital regulations was in 1989.